We were actually hoping for a mention of MECFS and long COVID in the budget and some specifically allocated funds for service delivery. Whilst funds have been allocated prior to the budget through the Medical Research Futures Fund for long COVID, and there are other funds allocated in the budget for other measures that may include long COVID, there was nothing specific, no specific mention. And whilst research is being conducted and we understand the government's need for more information, research takes a long time and patients need support now. And unfortunately, for Emerge Australia, which is the national patient organisation providing support and services to people with MECFS and those with long COVID, as a result of the delays experienced by a new government, we're going to have to cease our service to those patients because we've had no clarity on when funds will flow.
So what services do you offer?
Emerge Australia offers a range of support services, particularly through telehealth, education support to people with MECFS and now people with long COVID. We've had over 2,000 calls in the last year, and we're getting increasing numbers of calls from people with long COVID to speak to our specially qualified nurses who can provide advice on how to manage and live with MECFS and long COVID, which affects 250,000 Australians each year and an anticipated 400,000 additional people who are estimated to get long COVID. This is a big issue, and people with MECFS have been overlooked for a very long time, and we would have expected that that would have been recognised in some way in the budget.
So, as you say, your organisation campaigns for people with MECFS. How similar is long COVID to that condition?
Long COVID and MECFS have very significant overlapping symptoms, and some of those symptoms are brain fog. There's multi-system issues with regard to the digestive system, to cardiac systems, etc., all of which are present in long COVID patients as well. And we need to understand that both conditions are significantly debilitating. With people with MECFS, there's 60,000 people in Australia with MECFS who are either housebound or bedbound. And those people have been largely overlooked by the health system because we don't have answers, and that's just not good enough. And we are hoping to work collaboratively with the federal government to deliver vital supports to this patient cohort who need our help. It's not just a health issue right now, it's actually a human rights issue, because these people are being turned away because doctors actually don't know what to do with these patients, because we don't have the treatments, we don't have the biomarkers, and it's just not good enough that these people are overlooked. And so we are really looking forward to hearing from the federal government very soon, because what we will have to do as an organisation is close a service just before Christmas, which means people won't get the vital support that they need. And from Emerge Australia's perspective, we'll have to have staff whose livelihoods will have been impacted as a result of the delays in notification about funding. It's just not good enough.